For 150 years, the American Public Health Association's dedicated public health officials and organizations have worked diligently to create the world's healthiest nation. APHA is the only organization that combines a broad-based member community with the ability to influence policy and improve the public's health. From the beautiful city of Boston, this is the 2022 APHA Annual Meeting and Expo, and this is APHA TV.
Hello and welcome. I'm Autria Godfrey, your host of APHA TV, and I will be taking you through the next several days of sit-down interviews, specially curated content, and session highlights from the 2022 APHA Annual Meeting and Expo. Today, we will hear from session speakers about APHA's advocacy in action. We hit the conference floor to hear from attendees about what 150 years of APHA has meant to you. Plus, we begin our tour across the country to highlight the organizations and universities at the forefront of the public health fight to create the healthiest nation. To kick things off, here now with a warm welcome for this milestone meeting is APHA Executive Director Dr. Georges Benjamin.
Hello, I'm Dr. Georges Benjamin. As the Executive Director of the American Public Health Association, I want to be the first to welcome you to APHA 2022. We're glad you are here and joining us, especially as we celebrate the culmination of our 150th anniversary. As always, the annual meeting is the place to network with and learn from other public health professionals. We've lined up thousands of educational presentations and hundreds of business meetings, along with lots of opportunities for fun and getting together. I hope you will take advantage of these new and exciting activities. 1, attend one of our featured sessions, focus on abortion rights, climate change, and public health workforce, and more. And many of these, the speakers will hang out for a coffee talk afterwards to continue the conversation. Number 2, sections and affiliates have organized coffee talks as well on the next big thing in public health. Bring your breakfast, grab a coffee, and have an informal chat with APHA leaders and your peers. Number 3, APHA Place. That's the new name for APHA Expo. It's full of new opportunities to engage one another. You can visit the APHA and Ernst & Young Leadership Lab for a series of business leadership and management-focused professional development sessions. Stop by the Emerging Scholar Symposium to hear student-led presentations about cutting-edge research. Meet the APHA team at APHA Central to learn about new member benefits, purchase our 150th anniversary merchandise, join a book signing, meet the AJPH authors, and so much more. Join us for the taping of America Dissected on Sunday at 6:30 p.m. This podcast is hosted by Dr. Abdul El Said, who will sit down with New York Times' Jane Coaston, host of Argument. Help us celebrate APHA's 150th anniversary, and you will find little pieces of our history throughout the Convention Center and the Westin Hotel. Visit the history installation in the North Lobby to learn about our past and think about our future. Attend the Monday General Session, which will focus on 150 years of public health history. Be sure to celebrate with us Sunday night. We'll have desserts, music, entertainment, and lots of fun. We're thrilled to have more than 10,000 people joining us in Boston. And if you're one of the many people who are watching these recordings at home, we're equally pleased to have you join us. I hope you will take advantage of the thousands of sessions to watch at your leisure. We're especially excited to offer these digital recordings as a way for those of you who are unable to travel to participate and share in the learning. No other meeting confers such a wide opportunity for topics affecting health. Thank you for doing all you do to create a healthier community together. We will create a healthier nation.
Disparities in health and mental health arise and persist as the result of complex individual, societal, and global factors. The faculty and students from Northeastern University share a common commitment to promoting health equity and social justice through high-impact, community-engaged research.
The Institute for Health Equity and Social Justice Research is devoted to research and its practical application to improve the health and well-being of the residents of our communities. The Institute is focused on the social determinants of health in community settings, the promotion of health equity, and the elimination of health inequities.
So when we're thinking about research, I think oftentimes we focus a lot on the why, like why we do research, what we do in terms of research, how we do it. And the who is so important because that's essentially what the research is for, is to then ultimately help the community. And then in terms of, well, community partners definitely need to be part of that conversation to let us know to what extent that we can best support their needs, interests, goals, and so forth.
I love the Institute because it has faculty members across disciplines and across interests, and combining those interests together to promote health equity in a number of different realms. And I really appreciate seeing like-minded folks working together on different problems to solve a bigger problem of health inequity.
With her finger on the pulse of the public, APHA President Kaye Bender knows what the most pressing problems are facing our public health community. Fresh off of her tour of affiliates all across the country, she joins us now in studio with more about what she learned. Good morning.
Good morning. It's nice to see you.
Well, thanks for being here with us today. You just got back from your last stop in Washington State.
Right.
Talk a little bit about what you learned from talking with those who are really at the forefront of the fight of public health.
Yeah, it's been an awesome year. I was able to travel to about 15 of APHA's state affiliate annual conferences and another 3 or 4 virtual. So it was great to be able to be with them in person and to reconnect. You know, it's really interesting. Almost all of them are really seriously dealing with policies and systems and leadership around health equity. And about half of the affiliates have declared racism as a public health issue. And the others who haven't quite been able to be that bold are still working on it, you know, sort of more behind the scenes given the political environment. So there's been sort of this unified national movement with a commitment to equity and racial equity as well. So that gives me hope for the future. The other observation is there's been this real excitement around engaging with students.
Oh.
And you know, APHA, a third of our membership are students. We have almost 8,000 student members. And so the state affiliates all around the country have just employed really innovative ways to engage students and recognize that those are our leaders of the future. And we talk about the students are a third of our membership, but 100% of our future.
Oh, I love that, yes.
And so it's just been exciting to me to see the student engagement and the real commitment to listening to students and to getting their ideas incorporated into practice.
Sounds like a great trip all across the country. Now, you've also launched a bunch of new initiatives during your time as president. Can you tell us a little bit about APHA Your Way?
I was fortunate as president-elect to co-chair our member unit effectiveness and engagement project, and that led to several recommendations about how we could re-engage all 25,000 of our members. And of course, one of those was to replace our old system for communicating with APHA Lead. And we launched it this summer, and we have over 200 different communities. And I've been really excited to see our members take advantage of that and really be able to communicate with each other and build each other up.
And this is an online portal, a kind of online community.
It is an online portal, and we had an older one that wasn't quite as robust in terms of supporting cross-sectoral communication all across APHA, and APHA Lead does that, so it's pretty cool. And of course, another set of recommendations we heard from that member engagement project was APHA's big, and there's so many topics and so many structural units that it's real easy to feel lost, especially when you come to the first meeting and maybe there are 10 or 12,000 people. So we started the Mentor Match program, which just launched, and they're currently signing up members. So if people listen to this, hopefully they'll go on APHA's website, look how to sign up. Because I had a good mentor back in the 80s when I joined APHA, who told me how to navigate all of the sessions and to get the most out of it. And so that's really cool. And then we have the Distinguished Leader Mentoring Program, which connects students and early career professionals with public health professionals who've been successful and been around a while. And it's a series of webinars and even electronic sort of one-on-one or small group mentoring where we can talk about it. How do you find the job you want? How do you really beef up your resume? What kind of experiences do you need to engage in order to be successful? So it's really cool.
Wonderful. Well, congratulations on a successful year, and thank you so much for your time today.
Thank you.
At the University of Louisville's Health Equity Innovation Hub, the mission is to advance social and health equity for structurally marginalized communities by engaging people from these communities in everything they do, from research to talent development and even entrepreneurship.
The Health Equity Innovation Hub is focused on advancing social and health equity for structurally marginalized populations. We're doing that through research, through talent development, through innovation, and through entrepreneurship.
Research teams that are able to go to community to build relationship with the Louisville community in a way that hasn't been done before.
My focus is to help Black, Brown, Latinx founders really help in their communities thrive. Being able to get mentors and get the capital they need to take those ideas from here all the way into a product.
You get the direct benefit in access to resources, educational opportunities, a compounded benefit to those persons' families. And then thirdly, I think the community is inspired to do equity-focused work.
What we're trying to do is creating the connections among the different sectors, the research, the community, the startups, the innovators, the entrepreneurs, to build ecosystems focused on equity of the communities that they serve.
So much specially curated content to cover, and we want to make sure you don't miss a minute. You can always find the latest APHA TV episode on the TV monitors throughout the convention center, on the in-house TV channels at several of our partner hotels, on the APHA website, and of course on our YouTube and Twitter feeds.
The governmental public health workforce is one of the most essential elements in creating the healthiest nation. But how do we make sure we have a strong workforce? Brian Castrucci, president of the De Beaumont Foundation, joins us here in studio to discuss. Thanks for your time this morning.
Thanks for having me.
So one of the things that the pandemic really highlighted was how under-resourced the public health workforce really is. What do you think are some of the key things that the pandemic showed we need help with?
Well, the pandemic shows that we have to get the workforce stronger and better and quickly. We already have an 80,000 person deficit in our workforce. We found that out with our Staffing Up report. And we know that 1 out of 4 people in the workforce now are looking to leave in the next year. So this is a perfect storm. And if we don't do something, we're going to suffer the consequences.
So what is it that you're looking for when it comes to creating this strong workforce that obviously we need a lot more bodies in?
We need more bodies, but we need them well resourced. We need to have loan repayment. We need to have better skills. We need to train our workforce better. If you don't come out of this pandemic thinking we need really good communication skills, then you were asleep through the whole thing. We did not communicate as effectively as we needed to. I'm not going to be a public health apologist here. There was a lot of things that we did wrong in this pandemic. We better get it right before the next time it's a lot worse.
You know, these public health workforces from city to city, state to state, they vary in size, they vary in the resources that they're given. How or what can we do, I guess, to engage the entire workforce?
Public health is a team sport. It's not just your health department. It's your businesses, it's your faith community, it's healthcare, it's everyone. And so regardless of what the size of your health department is or how well resourced you are, you got to find the assets that you have and maximize them. There's a lot you can do with, $5 and some friends, where in other communities they don't have some of the relationships that we have in smaller communities. So leverage your assets. Don't just focus on why you can't do something, figure out why you can.
Okay, we are celebrating the 150th anniversary of APHA. In your opinion, what do you think the APHA's impact is? What are some of the strengths? What are maybe some of the things we could work on looking ahead?
So when you look at the membership organization landscape in public health, we often fall back into our silos. APHA is the cauldron. It's a place that we all can mix and mingle and figure out how we work together across our different silos. This is the one place where you can have a governmental public health person talking to a business leader and then engaging a nonprofit executive. That's going to happen at APHA, and that's why it's important.
All right, Brian, thanks so much for your time this morning. Appreciate it.
Thank you.
There are a lot of great ideas to help solve problems in public health, but how do you put those into practice? Loyola University Chicago is figuring it out by pushing public health entrepreneurism and partnering with innovation hubs to move the needle.
My name is Natrina Kennedy. I graduated from Parkinson's School of Health Sciences and Public Health at Loyola.
We need, in our future leaders of academic public health and public health practice, the types of individuals that can come together, listen to community needs, and create solutions that can be scaled and sustained. This is what entrepreneurs are.
WHI stands for the Women's Health Initiative. It is my very own nonprofit. We are a 501c3, and ultimately we are dedicated to decreasing health disparities by tackling social, economic, and racial barriers to health, specifically with Black and brown women. So that's my baby, and I founded it fresh out of undergrad at Loyola.
Health equity issues are so huge, you can't look at it from one discipline. You have to work in an interdisciplinary fashion. That's what the Center for Health Innovation and Entrepreneurship will be trying to do.
The public health system in the United States is certainly a multifaceted system. So here to help dissect it all is Dr. Ted Brown. Thanks for your time this morning.
Pleasure to be here.
Let's start off with what you think some of the key issues are in APHA's history and how APHA has helped to shape public health.
APHA is an organization which since the early 1870s has reflected the major developments in American public health. And they have been various and often contentious. So some of the issues in the early days had to do with sanitation, the mobilization of proper housing for people who were suffering from awful tenement conditions, and also was very aware of new developments in science. The emergence of bacteriology is providing good guidance for scientific interventions.
So we're celebrating 150 years of APHA. What are some of the lessons that we can learn from the past as we look ahead to the next 150 years of APHA?
Well, the basic lesson, of course, that any historian would tell you is that nothing's going to remain the same. Things will change.
The only thing constant is change.
The only thing constant is change. And the association has, well, it's a tension between continuity and change. There is some continuity, of course, in some basic principles and approaches, but change is always going to be on the horizon, and change will always challenge the established view and the established way of doing things. What I think is the genius of the association is that it has figured out an organizational way of accommodating both of those impulses. That is, in the association at large, has really incorporated the notion of the abiding continuities and primary issues and values in public health. On the other hand, as new issues emerge, whether they be about occupational health and safety, child safety, whether substances like tobacco and other addictive substances have public health significance, whether gun safety is a public health issue or not, which the association has now come around to believe. When these new issues emerge, there's a natural resistance because that's the continuity speaking in. Continuity means a little bit of inertia. That's the way human history works. But against that is an insurgent force of saying there are new issues, new priorities, we have to address them. Organizationally, the way the association has acknowledged that is by allowing the creation of special interest groups or caucuses that represent the most eager and energetic advocates of those positions. So the Maternal and Child Care Caucus, and an Occupational Health and Safety Caucus, and Environmental Safety Caucus, et cetera, really being the channel for those no interests to come to the mainstream of the association. And that wonderful tension between them is what keeps this organization so vital.
Wonderful. Dr. Ted Brown, thank you so much for your time this morning. And you mentioned protecting the public as being one of the key tenets of APHA. But on that note, access to healthcare is certainly not equal across the board. Let's take a look at the work being done by the Paragon Health Institute to evaluate if government programs are actually working to improve the overall health and economic well-being of all Americans.
There are some pockets of the U.S. health system that are excellent, but there are major areas of dysfunction within the U.S. healthcare system. Paragon is the premier research institute in the country focused on evaluating how government programs are actually working, not just the intentions behind government programs, and then evaluating free market solutions that empower patients, that reform these programs, that realign incentives so that we're not just focused on increasing spending, but getting increased value out of the system.
Paragon has gathered a team of true experts who have been there, who have done it, who know how the government works, how it should work, and we are here to be a resource to anyone that wants to see our system improve.
As we mark this milestone of 150 years of APHA, we talked with attendees to hear what they feel has been the greatest accomplishment over the last 15 decades.
So for 150 years, APHA has been a champion for the notion that every human being deserves an opportunity to live a full, healthy, and productive life.
I feel that APHA accomplished over the past 150 years. There have been many, but I would like to highlight their focus on health equity and racism as a public health topic and a public health issue.
APHA has been a leading supporter of civil rights and championing public health and population health for diverse racial and ethnic populations in the U.S. and abroad.
I think the accomplishments have been many, but particularly making public health more of a household term.
They have tackled every issue that mattered over the course of time, and the issues have changed. They dealt with infectious disease control, they dealt with chronic disease promotion, they've dealt with environmental challenges, they fought for rights, reproductive rights, health rights. They've dealt with racial and ethnic disparities, health equity, championed justice as a cause.
I think APHA has been persistent in its support of cutting edge research, milestones in public health, for instance, seat belts and things that we don't think of anymore, vaccinations.
One of the most important accomplishments that APHA did was recognize early on that there needs to be training of public health professionals in emergency preparedness. They passed a policy statement in the 90s just on this purpose.
But I think to me the most important thing APHA does is bring together people from a wide array of communities, disciplines, fields that might never come together otherwise, but because we share that vision and that purpose, this is the place we can come, share our ideas, our visions, our dreams, and make that reality that for everyone, public health matters and everyone deserves to have the best healthy life possible.
Looking forward to the next 150 years.
A lot to be proud of over these last 150 years, and still much more ahead this week as the 2022 APHA Annual Meeting and Expo continues. APHA TV will continue covering it all from Boston.
So much specially curated content to cover, and we want to make sure you don't miss a minute. You can always find the latest APHA TV episode on the TV monitors throughout the convention center, on the in-house TV channels at several of our partner hotels, on the APHA website, and of course on our YouTube and Twitter feeds.
Thanks so much for joining us here on this fun first day from Boston. We will see you right back here tomorrow.